Welcome to the Veterinary Project Podcast, episode 145.
Welcome to the show created by vets featuring absolutely no pets. This is the Veterinary Project Podcast, hosted by Dr. Michael Bugg and Dr. Jonathan Light. Our resident veterinarians have swapped out their stethoscopes in favor of microphones to bring you the Veterinary Project Podcast, a show focused on real conversations, aimed to connect this amazing profession full of remarkable people. Through the sharing of collective stories and wisdom, and connecting over the many unique challenges we face, we invite you to join our community of veterinary professionals leading intentional lives. And now, here are the hosts of the Veterinary Project Podcast, Dr. Michael Bugg and Dr. Jonathan Light.
Welcome back to the Veterinary Project Podcast. You are joined by Dr. Michael Bugg, Dr. Jonathan Light. Mikey, how are you doing on this fine Friday?
Doing well, Jonathan. Doing well. The 2024 activities back rolling. So Fridays, we got swimming lessons and the wave pool's back working. So I'm jazzed to go do some of that later here after this is wrapped.
So you're learning to keep your head above water? Is this what I'm hearing? This is the 2024 goal?
Yeah, with a 4-year-old clinging to you. That's the key.
That makes it more difficult right there. Excellent. So that's the afternoon activities. You were just coming back as well, too, from getting fitter this morning when we first got going.
Oh, yeah, trying to do that thing. Where are you at? So this is going to be a weird one for our listeners because we're recording this kind of mid-January, but we don't even know when it's coming out. It's coming out later here in 2024, but where are things at in the Light household with all things 2024?
Yeah, pretty exciting, actually. So we've been at an exercise physiologist here for just over a year now. I had a check-in this morning, and then Candace had one last week. For myself, I wasn't expecting much for a change, but I have been doing quite a bit more cardio through both squash, hockey, you name it, outside rink, etc. But then also doing more hypertrophy exercises, getting in the gym. I'm gaining. So it's going in the right direction, getting stronger in the legs. Some issues I was having aren't there anymore. So just got to keep on stepping it up. And Candace is now in free getting ready for her show in 2024. I don't know if I'm supposed to say that or not. So she's in go time. She puts me to shame.
You did say it. It's always very impressive what her commitment level.
And she just does it. Like if you're talking about somebody in consistency, it's a perfect example of it. I was reading a beautiful thing on how education isn't just a one-time event. It's the practice. Well, it's the same for her. Her show and all of that result is not just a one-time, oh, let's go get sprayed brown and show up on a stage. No. It's thousands and thousands of hours before and all the commitment, etc. And it's fun now. Like 3 times this week. Now I'm going on a rant. It's just cool. Our kids are old enough that they're getting more involved. They see it. We tend to do it first thing in the morning. So when they're waking up, we're downstairs in the gym or the area. So pretty awesome.
I'll just chime in only because you mentioned your kids. So Rosie and I did like the goal setting thing at the end of the year. And then we were writing some of our goals down and Riley kind of caught a glimpse and she's like, well, what are you guys doing? And we're like, oh, we're just writing down some family goals for 2024. And she's like, well, I want to do that. And she can't write yet. She can write her name, but she grabs a piece of paper and writes her name and then scribbles. And I was like, oh, well, what does that say? And she's like, I want to play outside. And I was like, oh, how many times? And then she said like some ridiculous 4-year-old number, like 1,100 million. And I was like, well, do you have another number? And she's like 18. And I was like, so we're going to play outside 18 times. But still, just to see it coming through, I was like, oh, that's amazing.
Just lights the heart up, doesn't it?
Yeah. So
it's fantastic. Well, sounds like we're off to a good start for January on both ends. There's a lot of things happening behind the scenes for both of us. Today's conversation, I'm quite excited about. We have one of our most popular guests who now we figure is times 6 or times 7 onto the podcast, Dr. Jordan Woodsworth, joining us today. And the conversation today, as you recognized after the recording was over, she's in her zen. She's come into herself in terms of being able to communicate. She already is an amazing communicator. But in terms of what we're discussing today, which is both relevant for new grads as well as grads that have been out for a long time, how to deal with confidence issues, talking about spectrum versus gold standard care, and some of the pushbacks we have both internally and externally. She did an amazing job. So this was a really fun conversation, and we literally only got to 1 of 3 parts we wanted to cover because that's what happens when Jordan comes on.
Yeah, it's interesting time. What we were talking about, we do these things, but we have to realize it's a practice, right? You know, like you're always working towards, it doesn't just happen in one day. And when she was talking about her backstory, we worked together in 2012. And I remember having conversations with Jordan before she moved to WCVM, where it was like, well, I would go over and it's kind of this new position. And like, there's uncertainty at that time back in 2012. And now fast forward 12 years later, see what she's all done in that role. And I just was fortunate enough to be there when it was just an idea and we were friends and we talked through it, and then see it all come through and see what she's done. It's really amazing. And it's also inspiring, like for those listening, when you have maybe that opportunity that is just an idea, 12 years from now, it could be truly, truly amazing. So
absolutely. Yep. She's an amazing human. She is a benefit to anybody listening to this podcast, and proud to call her a friend. So for those that have not listened to Dr. Jordan Woodsworth in the past, she is a small animal clinician who graduated from the Western College of Veterinary Medicine with Mike in 2008. In 2012, she returned to the WCVM to start the Wellness and Preventative Medicine program in the teaching hospital and to spearhead the Northern Engagement and Community Outreach, the NECO program. In 2023, she completed her PhD in Community and Population Health, which allowed her to engage in collaborative research with the members of a Northern Saskatchewan community she has served through the NECO program for almost a decade. Her primary role now is as director of NECO, and she continues to explore new ways to bring awareness to animal health and welfare inequities in Canada, with the ultimate goal to devise creative, community-led solutions to improving access to animal health and welfare services. Jordan continues to learn from colleagues and mentors about how to foster and develop anti-racist, anti-oppressive, and anti-colonial environments within veterinary medicine, as well as playing a key role in the development of WCVM's anti-racism strategy. Outside of work, Jordan is married to her high school sweetheart and is a mom to 2 amazing kids and a lovely dog. She loves being in her garden or at the lake, traveling with her family and friends, crafting and cooking and eating amazing food. She didn't put in there being on the Veterinary Project podcast, but we also know that's one of her endearing qualities that we love to have her back for more in 24. Enjoy this conversation. It's not very wide range today. It just is a great conversation, and enjoy Dr. Jordan Woodsworth. Jordan, welcome back to the podcast. It is fantastic to have you back on. Just prior to us getting going with the recording, we were counting how many times you've joined as a guest now. And for those that are not aware, we believe, we're not positive, but we believe this is number 6 or 7, correct?
I think number 7. Yeah, I'm a frequent flyer.
That puts you far and above our next most guest. But as we're also saying, we look at analytics and your episodes are among the highest rated and the most listened to. So a pleasure to have you back on at the start of 2024. For those that are not aware or have not partaken in those earlier episodes, give us a little bit of an overview, a little flavor of who Dr. Jordan Woodsworth is.
Yeah, well, my name's Dr. Jordan Woodsworth. I'm a small animal veterinarian and a classmate of Mike's, and I've been in practice in Saskatoon since we graduated in 2008. So my first 4 years were in private practice, and Mike and I actually worked together. And then in 2012, I started a job at the Western College of Vet Medicine. And so I was hired here originally to create a couple of new clinical programs for fourth-year veterinary students. One focused on wellness and preventive medicine in the small animal hospital, and the other one focused on providing veterinary services to underserved communities. And so I've been doing those things for the past, 12 years now. And I am a recent graduate with a PhD. So I just did a graduate degree in community and population health. And so now my job is mostly focused around doing stuff with Northern and Indigenous communities, improving access to care, and those types of fun things, and doing research along with that. But I'm a big communication nerd at heart. I love doing communication coaching with students and with interns and residents. In 2016, I was able to go down to New Haven, Connecticut, and get certified as a healthcare communications coach through the Institute for Healthcare Communications. And so that's why I come and chat with you guys about how to talk to people in all of these episodes. Those are materials and skills that I feel are really invaluable for us as people who basically talk for a living, even if we don't think about it that way most of the time.
Amazing. And now having your doctor designation, we remove the PhD candidate, celebrate with you. And today we're going to be focusing that communication and that aspect of the ability for newer grads, but not only newer grads, as you said, we're in a communication game. If we can get the hard stuff right, then it becomes less hard. You enjoy your job better, and we see more value being communicated back and forth between the clients we serve. So happy to have you on for sure. Thank you, Jordan. Place to start. newer grads, potentially a real lack of confidence or perceived lack of confidence. And we're going to dive into a couple of specific areas today, and that's talking about money. Hard place. No matter the economy, we're in an inflationary period. We're in a part where people are looking after their dollars in a bigger sense, without a doubt, in this period of 2024. But no matter what, no matter the year it is, individuals want to know when they're bringing their pets in for care that there's value being communicated with and directed as they're looking at the treatment of their pets. A place to start, Jordan, as you've worked with your students and seen it out in the world, is what are some areas where veterinarians fail to communicate effectively when it comes to the translation of money in that equation of communication?
I think it's a really important question. And unfortunately for us, we're a communication-based profession, but we're also a fee-for-service profession. So we kind of have to do those two things well. We have to communicate well, and we have to talk about money. It's really interesting because what we know is that I think there are a couple things at play always when it comes to people's lack of comfort or their degree of comfort when it comes to talking about money with clients. Part of it is that we tend to, for some reason, give students in our veterinary programs very often the sense that there are usually one or two right ways to tackle any type of presentation that comes through the door. People have this really tight alliance to this idea of a gold standard of care, whether that has to do with how you're going about your diagnostics or what treatments you're providing. And I think that that really ties our hands in a super big way because there's so much complexity in terms of how we actually go about dealing with any case that walks through our door. So I think when we bring money into the conversation and why it's hard to talk about it, one of the reasons is that we can have a tricky time thinking about what are the other options outside of that idyllic gold standard. We often don't have a really great sense, especially in the beginning, around how do we communicate the value of whatever the expenditure is going to be to our clients? How do we guide them in making those decisions? So contrary to what I think a lot of people used to believe in veterinary medicine, we're not the decision makers, right? As veterinarians, we're not the ones making the choices about what our clients are going to do. We are the information deliverers. We're the experts. We get to do an assessment, make a recommendation, and then help our clients with whatever they decide to do as far as the plan goes. I think we put a lot of pressure on ourselves to make the right choice, even though it isn't ours to make. So yeah, I think it's a conversation about our discomfort about talking about money generally as a culture, as a society, but also these challenges around how do we go about making recommendations, making decisions, and then executing those in a way that clients feel good about.
Excellent. A lot to unpack there. In summary, the integration of what are we learning in school? What is the education from a gold standard? And we're going to discuss that. Then also integration of confidence and acknowledging that it's not our choice, but it is the choice of our clients. And how do we communicate that? And then also resonating what I heard is how do we deal with the 1 to 2 choices when there actually could be multiple choices or iterations? And I think what I would add to that in the context of a small animal presentation is you only have a certain amount of time as well.
That's right.
And is that the veterinarian who on the team is delivering that message, who's comfortable with it? And then what do we do once those objections come back? Because they're going to come back. That's part of the process. Let's start at the beginning. Let's start at where you're at, the Western College of Veterinary Medicine. It is, I'm going to say we're a little ways out now, all of us 14, 15 years out of school. It's ingrained in us. It's a triage hospital center, tertiary care, gold standard is the only way to go. And if it's not the only way to go, it's one of 2 options that are available. By the time we get to 4th year, we have heard that. And I'm hopeful that that has changed. But as an employer of multiple vet clinics, I still hear this out of my 1st and 2nd year vets coming out. Am I right in that conclusion, or do I need to evolve?
Well, I think that there's more of an acknowledgement that it's important for us as educators to help students with understanding how to practice along a spectrum of care, right? That's the terminology that we're using is gold standard is one aspect of the full spectrum of care that we might provide to an individual patient or a group of patients. We know that historically we haven't done a great job of, and this is the royal we, this is all veterinary educational institutions, not just the WCVM, that we haven't always done a stellar job of giving our graduates the skills and the confidence to practice along a spectrum of care. I think it's been a little bit of a bell curve curve, right? Where that was the status quo for a very long time, was practicing along a spectrum of care. And then we kind of, like, all of our science evolved, the number of specialists and specialty areas evolved, all of that sort of jazz. And so I think the rise and the amplification of centering the gold standard really rose. We see this even in veterinary literature, kind of from about the 80s until now. That's when the gold standard started to really be talked about in the medical literature. And now we're at the point where we're recognizing that gold standard is one way. It's only called the gold standard because it might have the most evidence base behind it. It's not always the best, because if we think about how we identify what a gold standard might be, that's using things like randomized controlled trials, right? Which we don't have a ton of those in veterinary medicine anyway, when it comes to a lot of they cost a lot of money. You need, in order to have enough statistical power, you have to have a fairly large number of subjects, those types of things. And it's just not that common, especially in small animal clinical research. So in order to have that RCT and to have all those things, it's a really controlled environment, right? You're going to have animals that are pretty standardized in their presentation much of the time, not always, pretty standardized in terms of their health status, their age, all of those things. And that's not the reality in day-to-day practice. And it also doesn't take into account the pieces of the puzzle when we're serving the public of the client, the family environment, their own financial status, also their values and their expectations when it comes to how they are going to work with the veterinary team and what they want out of their experience there. So I think that because we're recognizing that focusing or centering a standard of care we call the gold standard, that is in many cases actually unachievable, that actually makes it so that we can't, or we aren't serving everybody, or we're not serving as many people and as many critters as we want to be or as we should be. And that leads to client dissatisfaction, but it also leads to team dissatisfaction. So when we're looking at reasons or ways that we might be able to improve access to veterinary care, but also improve everybody's satisfaction with the whole process in general, understanding, becoming skilled in knowing what a spectrum of care is and identifying like what's good medicine along that spectrum, and then where does the spectrum end, and now we get into malpractice, right? I think that those are the things that are really important to find out and to get comfortable with. So that's a really long-winded answer, classic me, to a short question, but I think it's important to understand where that trajectory kind of has taken us.
So if gold standard is now being viewed that, hey, we need to evolve, the bell curve is changing or maybe potentially changing towards a better end, is there a true definition now in 2024 of what spectrum of care entails? Or is that still up to the individual, the institution, or perhaps the practice that's being carried out?
That's a really good question. And I think there's a lot of good material out there now that's talking about spectrum of care. And the way that we kind of understand spectrum of care is that it's the full range of ways that we might approach a particular presentation. So let's say parvo, for example, right? A really easy example. In an ideal situation, you have a dog that comes in vomiting, diarrhea, hasn't had vaccines, is like 12 weeks of age, maybe it's black and tan. You're probably going to want to immediately test that dog for parvo. If it's positive, or even if it's not, you're probably going to want to hospitalize that thing, put it on IV fluids, do all of the things that we would do within that gold standard, right? That we teach our learners are what's necessary in order to have good outcomes for that patient. There are lots of other ways to manage parvo that can lead to decent outcomes. And the reality is that if I have a dog who comes in looking, smelling, and quacking like parvo, and the client doesn't have the funds to do any of those things that I mentioned, what are my options? I can say that if they don't do the things that I've recommended, they are negligent. And I'm going
to surrender their animals, which happens.
That's right. Yep, exactly. So your choice here is to do this treatment or surrender your animal, which I would argue is problematic from an ethical standpoint. Might be a different conversation for a different day. And on the other hand, right, euthanasia would always be another option. But is there a gray area in between? So have either of you guys ever seen a situation where a quack and parvo case walks through the door and you don't do the parvo test and the IV fluids and hospitalization and all those things, right? And have you had success with those cases?
Yes.
I have.
But the back of my mind says, if this doesn't go well, oh shit, am I in trouble? Oh shit, is the owner coming back at me? Or oh shit, is the mortality rate going to increase, which we know we assume it will. And so is this pup dying as a result of me not being able to communicate effectively to the gold standard of which we were taught.
Yes,
Tough.
absolutely. And so all of those things are going through our heads. And so I think that's where the conversation is. So why does that happen to us? Why do we have all that stuff in the back of our minds? I think it's a combination of the imposter syndrome thing that so many veterinarians have, right? Where we're like, well, actually, I'm like the worst vet on the planet and I'm just hiding it real well. And it's not only new graduates who have that, all of us have it sometimes. And 99.9% of the time, it's not true at all. So I think that's part of it. I think that some of us are scared of regulation, right? We're scared of what our regulatory bodies might come back with if there's a complaint made against us. And then I think a lot of us really just don't want to do something wrong. We're scared of doing something that hurts an animal or that damages our relationship, our reputation, all of that sort of stuff. I think it's complex, right? So there are some really good ways to manage all of that fear that's tied up in this type of situation. So in the
what
parvo
are
puppy, in the parvo puppy that we're talking about, I think that or any animal, documentation and communication are like the two most important things. So you were mentioning that the reel is going in your head when the tape is playing in your head about all the risks of doing the non-gold standard approach to a parvo puppy. You're thinking about, okay, is my regulatory association going to come back and slap my hand or worse? Is the client going to try and sue me? Is the puppy going to die? So those are three things that I think we can communicate and record our way out of or prevent by using these tools. So number one, regulatory association. We need to be able to demonstrate that we've done our due diligence. And so one of the things that we always say to our veterinary students, to our interns, is if you don't write it down, it didn't happen from a legal standpoint. So if there isn't a record somewhere of the conversation that you've had with your client, then it is not admissible in court. You can't just say, yeah, but I said that and it wasn't written down. And not that we need to always have litigation on our mind, but I think that one of the ways that for me anyway, I sort of gauged whether I have done enough when it comes to documenting my interactions with my clients is thinking, okay, if this had to go to court for some reason, would there be enough detail here to effectively demonstrate that I did what I am saying I did? That's number one. If you are suggesting to someone that they take a treatment option that's different from the gold standard, it's important that you've talked to them about all of the options and that you've recorded their wishes. And so one of the things that I've definitely done in the past is if I've made a recommendation and clients have said, no, actually, I'm going to go this other route, and we've talked about the potential risks there, I get them to sign something to say, yep, I sure did say that I wanted to take my puppy home and have some oral Cerenia and give it some oral antibiotics and some wet food and hope for the best, right? And so if that happens, we just need to have it documented in a really complete way. So that solves the regulatory piece of the puzzle. No regulatory body is going to say you committed malpractice by going through that process. That
Agreed.
Also kind of solves the second piece, which is the client complaint aspect, because you have done your due diligence. You've been extremely clear with the client about what the benefits and the risks are of each of the potential options. And you've cemented that by having them sign the piece of paper or the digital pad or whatever it happens to be, right? To say, yes, indeed, I did agree to this. And yes, I understand what the risks are. Now, the third piece is a little bit more complicated because we don't know what the outcome is going to be for that puppy. For sure. When we're thinking about a spectrum of care, or really any approach to care with our critters, with our patients, we have to be thinking about, is this animal's welfare protected? Because ultimately, from a legal standpoint, that's the most important thing, right?
Yeah. And we're partly responsible for that. We're in a large way. We are the professionals that have come to, and there's an animal in need. That's part of our oath that we've taken on.
Precisely. Yeah. And I mean, when it comes to, again, when we're thinking about policy that's out there, right? I mean, in Saskatchewan anyway, the Veterinarians Act has very specific language about veterinarians' roles and responsibilities. So when it comes to that piece, I think that if we are working with a client on a non-gold standard approach, we've recorded it all, we also have to have a follow-up plan. So if I'm sending that puppy home, if that puppy's come in with like a body condition score of 2.5 out of 9 and it's looking real dull and it's pretty darn dehydrated and I've given it some sub-Q fluids before it goes out the door, I want to hear from that client in like 6 hours. I want to know that the puppy is perking up before I go to bed that night. And if not, if the puppy's not perking up, then I think that's our opportunity to say, okay, now, and talk about this before, but at that point say, if the puppy's not perking up, now it's time for us to discuss what we're going to do now. So at
That'd be
that
part
point,
of
I
the
would
whole
say,
treatment plan from the
yes,
start.
that's
Yeah.
right. And so now we're at the fork in the road where our options are either surrender access, augment funding or auxiliary
Yes.
funding to do the gold standard, or euthanize.
Yeah, look at other
That's
options.
where we're at.
That whole process that you've just outlined in an experienced veterinarian's mind can happen very quickly because we've synthesized it over years of experience, many different cases, positive outcomes and negative outcomes. What are some tricks or tips that you would recommend for those that are 0 to 3 years out that can't synthesize that information as quickly, also are already concerned with an overburdening of medical notes, the liability, and practically haven't run through as many cases, if we're using parvo as an example, to see all the iterations of outcomes that occur in that particular case itself? What do you do to help build that intangible confidence in this case?
So I think definitely mentorship is a big piece of that. I don't believe that any brand new graduate should ever be alone in practice. Physically, sure, maybe you're alone in the practice, but you should always have a phone a friend option, because the reality is that you are going to encounter things that you have questions about and that you feel uncomfortable about. And sometimes you got to, in order to sleep at night, you got to just know that you've actually done your due diligence and done it correctly. I think that that's number one. Number two, I think that, as we talked about before, it's really essential that people leave their DVM programs understanding what the different treatment options are along that spectrum for especially common cases, right? So if we're talking about thyroid disease, if we're talking about parvo, if we're talking about just regular old showing up with, exactly, ears, teeth, all the things, right? I think that for me anyway, the easiest way to synthesize this stuff and to really understand whether what I'm doing or recommending is okay or not, is ethical or not, is the animal's welfare protected? Like I said before, that's the most important thing at the end of the day. So is the animal's welfare protected? And then after that, are we also maintaining the human-animal bond where possible? And are we working within a good and trust-based and client-centered relationship with our customers? So I think that if those three things are true, you're doing okay. And if you can find that treatment protocol somewhere in a textbook or somewhere on VIN or whatever it happens to be, you can also justify it. Because at the end of the day, like when we're talking about what is malpractice, would a group of your peers say that you have done something inappropriate?
Absolutely. And that having just sat on a 3-day tribunal in December, I've been one of those judge and potentially juries, etc. Wow, can there be a variance? I won't go further than that, but the stories and the records and the witnesses and all the advice that's come forward, it's on a case by case basis.
Yep.
It is. It's unbelievable how complex just a simple case can be.
For sure. And I think that said, one of the things that's also can be really helpful for us is because, let's be honest, no one veterinarian has the time to go through all recent literature to find out what's up, what's new and exciting in parvo treatment, for example. This is where, when we're talking about how do we make sure that what we're doing is okay. I mentioned textbooks, but again, those outdate pretty quickly. There are also guidelines that we can look to. AHA, the American Animal Hospital Association, has a whole bunch of really excellent clinical guidelines for small animal practice. That's a really good place to go looking. And they're so good that they make these really long guideline documents that come out as academic publications, but then they also make summary documents or like guidelines at a glance that are short 1 to 2 page things. And then they also publish implementation toolkits. So for me as an educator, I use those a lot because that's where in practice we should be looking to if we're wanting to know what's up to date, like what's the up-to-date information about X, Y, or Z. So that would be another piece of advice that I'd have for folks is if your spidey senses are tingling and you're saying, ooh, I'm a little worried about what the outcome of this might be, and I've made this recommendation that's not gold standard, reference a guideline or some other publication in there where you can say, this is where I looked to find and justify my use of this particular protocol. You don't always have to do that, right? In reality, we're not going to do that every single day. But I think especially for those ones where you're feeling a little bit iffy about the safety or the ethics of that particular approach, and all three of those things we talked about before are in place, look to your guidelines.
Let's add in the final piece on it, which is the value that you have presented as the clinician for the particular case and treatment regime is met with the objection of dollar value. The owner either doesn't believe you, doesn't feel it's needed, or plain well just says, nah, I can do better down the street, or just give me that drug that I got 3 years ago and we should be fine because it worked in my other dog.
Yeah.
How do you handle that for the new grad or even the 15-year out or the team member that has to deal with that because the veterinarian left and said, no, you handle that as the RVT, somebody else. This happens every day.
It sure does. Yep. Gosh, RVTs need to be paid more. I'm saying that on the record. So that's an amazingly important question because, as you say, it happens every single day. I think there are a few things. Number one, I think we got to be really clear about clinic policies. So I think in the past anyway, I think it was pretty typical for individual veterinarians to have very different ideas on what would be feasible or justifiable when it comes to giving people breaks on their bills. I think that there's always room for some of that kind of relationship stuff, right? Particularly when we get into things like medical mistakes, etc. But I think that especially for new grads or support staff who aren't the decision makers at the end of the day, all that sort of stuff, I think that it's really important to have extremely clear clinic policies on what are our drop dead
Negotiables.
That's right. What are the non-negotiables when it comes to finances? And how do we approach these types of pushback in a relationship-centered way? So if I can ever leave people with a fundamental truth about veterinary medicine and something to always have in your back pocket is if your approach is relationship-centered, you're probably going to be okay at the end of the day. Because most of the time, dissatisfaction on the client side, on the team side, any of those things come when there's a lack of empathy and a lack of connection about whatever the problem is. And that's true in marriages too. I mean, you guys know that just as well as I do. So I think that if we can always proceed with preservation wherever possible of that relationship in mind, we're golden. That's, not to say that we take abuse and all that sort of stuff, right? There are, again, non-negotiables when it comes to preserving relationships with our clients and with our teams, but that's really, really important. So when people come and they're giving you a hard time about what it's going to cost, part of that really often is that they just haven't quite understood what the value is of that particular transaction.
I just told you 5 times. I told you the same thing. And yet you're still not believing me. Why?
Yep. Yeah. And so sometimes the question is, it seems as though I'm not doing a great job of sharing with you all of the details that you might need about the sort of reason for this cost and the value of that to your animal. So what further information can I share with you that I might be missing that would help us to get on the same page? Because here's my clinic policy. My hands are tied. In the case of the medication, I've got provincial policies, regulatory policies that tell me what I have to do. So I can't just dispense you antibiotics without seeing your critter first. It's necessary for me to do that. And I think this is where coming back to our core skills is really critical. So empathy always wins in every single one of these situations. I think we can all identify with that stuff's expensive, and sometimes it kind of is like painful to spend money that you maybe weren't planning on an unforeseen cost for something. Valid to say to people, I get you. This is a tough time of year. Everybody's just come out of big spending at Christmas, all of those things.
Blue.
Yeah, exactly. And so sometimes also that's where it's important to offer people other resources.
Jordan,
Excellent.
I was gonna add that piece because I look at the money side. So I look at like this sort of closing the gap on communicating value. To simplify it, there's 2 sides. There's the medical side, which we are experts at, right? We've seen the parvo case 1,000 times. So we know the value and we have to try and communicate that to the client. But on the money side, everyone has a lifetime of money stories, and they're coming into this. They got locked in the exam room with us for 30 minutes, but they have 50 years of money stories running in the background. And then we're going to throw a dollar amount on the table. We're going to say $750. And that number, which is just a number, is going to land totally different to a veterinarian that's making $100,000 a year and has absolutely no worries about how they're going to buy groceries, to a client that may be on the other side that's like, that 750 is rent and groceries.
Exactly.
And so like, that's the thing we have to recognize is like, we say money like it's just one thing, and it's not. It is like
No.
a billion different stories wrapped into one word.
And I think that's an incredibly important point, because there is always this huge money is an incredibly emotional thing, because capitalism, this is what we live in. And so it's like we all, as you said, we all have these stories about it. Not everybody has the same experiences or the same access to that particular resource. Then there's the piece about the animal, because we're talking about an animal that, especially on the small animal side, that a lot of people value to the same degree that they value their human family members. And so now we're putting a price tag on providing care for that animal. That can seem really cruel for people. As you said, Mike, there are several things at play, right? It's really, really complex, but there's the internal narrative and the lens through which the client is viewing the money aspect and their relationship to their animal, and then their expectations of the care that will be delivered by the veterinary team for their animal. And then there's the veterinary experience, so the individual narrative about money, the money experience in the past life, all that sort of stuff. And then the veterinarian's narrative, values, expectations about what clients are going to provide that will illustrate how much they love and care for their animal. And those things are kind of often at odds. And so this is why we get into a lot of conflict with clients when it comes to money, because our identity is often being threatened, because sometimes people say stuff like, you must not care about my animal very much if that's how much you're going to charge me. And then on the other side of things, I would presume that in a lot of cases when people are making those statements or those accusations, it's also because there's a substantial amount of guilt and perhaps even shame happening for that person about their own financial situation. So I think that that's very, very important to mention.
I think that holistic view of the entirety, and it is very complex. And Mike, you nailed it. Jordan, you followed that up with another great explanation. That entire package together, again, wraps into a rounded relationship-based discussion, as opposed to the vet-centric traditional discussion that says, thou shalt do and thou shalt listen. Doesn't exist, in my view, in 2024 for what we're trying to do, both for the animal, the client, and the care.
Agreed. I think the other piece of the puzzle is this circles back around to all our conversation about spectrum of care.
Yes.
Because one of the things that we can do to help ourselves and to help our clients is to talk about expectations and to talk about budget friggin' early on, and also to get really good at not making assumptions about people's willingness or ability to pay a bill. There's the kind of old story that we always think of as the guy drives up in a Mercedes Benz and then doesn't want to pay the $250 bill, right? And what does everybody say about that guy afterwards? But you don't,
and whatever
you don't,
else you know.
You don't know his situation. Maybe he's sleeping in his damn car because he lost everything else. We don't actually know what anybody's story is. So I think remembering that we actually have a responsibility to give people a range of options and to meet people kind of where they're at as much as is possible, keeping in mind the animal's welfare and obviously our need to keep our business afloat and all of that sort of jazz. I think that we can do a lot more than we sometimes think we can when we have those conversations.
Love it. This resonates so much back to another colleague and almost classmate of ours, Kent Weir, our number one guest on the podcast, first podcast describing, hey, when a client comes in and has this issue, but doesn't have that other one, and it's not affecting the welfare of that animal, though we want to treat it, though we see it as the issue, that's not what the client brought the animal in for. That's not what's important at this time. And again, if it's not affecting the welfare, where is my direction? Well, it should be directed to what the client and that patient needs, which may sometimes not be the same as yours as the veterinarian. I remember that always from episode number 1. Super important and greatly important for recent grads and new grads coming out. Everything looks so big. It's really not as complicated as it needs to be.
Yeah, there are fundamental principles that we can kind of hold on to that can help us through all of these difficult circumstances that, as you say, we can break them down. They're a lot less difficult.
Yes. Well, we're already at time. Go figure. We got onto one of our 3 topics in the time that we had today. Kind of 2. We're kind of 2 there. Now, next, what we want to do is get into medical mistakes. They are going to happen for newer grads, experienced grads. How do we deal with them? How are we transparent in our communication with our clients, with our team, so there's improvement? Again, a really important piece. We'd love to have you back in, Jordan, because if you can hit that right, because they do happen, they happen more than we think. Sometimes they're not published. Oftentimes they're not, but there's a guilt factor in there. There's a financial, all of these pieces. Would love to have you back on.
Yeah, love to come back always.
Thank you. Jordan, for those that want to reach out, learn more about you, understand what you do on a day-to-day basis, because we didn't even get into it today, where do they find you?
People can email me at jordan.woodsworth@usask.ca. You can also find me on the WCVM's website, so wcvm.usask.ca. And I'm within the dean's office, so when you're looking for people, that's where you find me. And there's a nice little section about myself and my team. We're called the Northern Engagement and Community Outreach Program, so that's where people can find me. And there are a few other places as well, so if people want to know more about my research and the things that I do, please touch base, and I'm happy to share that with you.
Excellent. Mike, any words in final and close?
No, I was a bit sad when you were leading this one. I was like, me and Jordan have just our relationship. So I was like, I'm just going to sit here and I'll try my best to shut up. And it's awesome, Jordan. I don't remember what episode it was from. I've learned a lot from you. I can imagine. And me and Rosalie have adopted that as a communication style, and we're talking about our businesses or whatnot. And obviously we have young kids right now. And sometimes I'll start saying something where it's like, I know how you, and then I'm like, but I don't know how you feel. I can imagine how, so when you started into here, it seems as though it's just masterful communication, and it can do a lot in helping the other person feel heard. So thank you for all of it. I'm excited for more episodes, but I'm going to probably steal the reins back from Johnny and lead the next one.
Amazing. Sounds great.
Next one, you've got it, Mike. For those that have not listened to those past episodes, please jump back into our long list. We'll have them in the notes as well, too. Jordan, thank you very much for joining us. Look forward to having you on soon again. In closing, though, as with always for our podcast guests, what message would you like to leave for the veterinary community?
I think the biggest thing is, especially for anybody who's a recent grad who's listening, because this was geared at you far more than you think. You don't give yourself enough credit. You don't think that you're valuable to this profession, but you absolutely are. And so just remember your fundamentals and ask for help when you need it, and you will always be okay.
Thank you for listening to the Veterinary Project Podcast. As a recap, on behalf of our hosts, the Veterinary Project Podcast will be releasing new episodes weekly. So be sure to tune in as we bring you more conversations aimed at helping you enjoy a life well lived. If you enjoyed what you heard on the show and you want to stay in the know, please like, love, and or subscribe to the podcast on the listening platform of your choosing, as we're available on all the usual suspects. If you know of others that may benefit from these conversations, we'd love it if you please share the show with them, as this will help us grow our community to reach more and more veterinary professionals. Speaking of which, if you are a veterinary professional and would like to get connected with more like-minded individuals who are joining us on this journey, please send an email to the Veterinary Project Podcast at gmail.com, and we'll invite you to be a part of our private Facebook group. General feedback, requests for information, or perhaps requests to be a guest on the show can also be sent to the Veterinary Project Podcast at gmail.com. Dr. Michael Bugg and Dr. Jonathan Light, thank you for listening to the show, and we'll catch you again next week for another episode of the Veterinary Project Podcast. Bye for now.